Assalamualaikum warahmatullahi taala wabarakatuh. Ini adalah kuliah yang dirakamkan untuk kuliah Jumaat 19 hari bulan Jun 2020. So hari ini kita akan topik yang saya akan kendalikan, topik that I am managing is teaching is assessing language, assessing language in speech therapy. So language assessment tools. So speech and language assessments should measure language production, language comprehension, non-verbal communication, and gesture. And gesture includes gaze and joint attention in young children. It should also assess pragmatic and figurative language, prosody, rhythm, volume, and content of speech. So we sort of try to measure all aspects of language comprehension and production, verbal and non-verbal. Yeah. Why are we studying this? Because these tools are tools that we use in our speech therapy clinic. So that is why it is included in the course Technology and Alat Bantuan. So it's an aid that you use to assess your children or your adults. So this description of the symptoms is important in characterizing and differentiating speech and language disorders. Difficulty in articulation or vocalization implies a speech disorder, whereas the inability to find words, difficult to comprehend, to read or write is indicative of a language disorder. So there's always this differentiation between speech disorder and language disorder. Differentiation of speech and language disorders has important localizing value for the underlying pathology within the nervous system, and it helps distinguish among different etiological processes. So once we identify that it is a speech problem, then we should be able to look into the etiology of speech problem and try to tackle the problem. The same goes for language disorder. Once we know it's language, then we know that we have to look into reasons which contribute to language disorders, and the level that we need to address would be words, sentence, etc. So the categories of assessment would have different types. Yeah. So you can actually do a indirect assessment by observing the child when the child is interacting with you and also with the parent. But in this instance, you're basically observing. Yeah? And a kind of indirect assessment would be the parent report. Yeah? And then we have the direct assessment, which is free language sampling, free conversation. Okay, free conversation, where the context is natural. The child is playing with the mother or the friend or the playmate, and the child is using language naturally. So you are sampling the language in a natural environment. And then you have the direct structured assessment, where you can have a criterion reference assessment and a norm reference. And then you have a direct semi-structured, where it is a dynamic assessment. So we're going to look at this one by one. The direct child observation is another strategy for young children. Another strategy of evaluation for young children. So, for example, the communication and symbolic behavior skills, CSBS, and the autism diagnostic observation skill, where it combines parent interview with professional observation of the child's social and communicative behaviors under semi-structured play. ADOS is a tool that's used in our Child Development Center in HUKM. The health professionals first interview the parents, and then the child comes in and we look at the child using the ADOS, where we ask the child to describe pictures, to tell a story, to act out certain instruction, and many others. Yeah. So these are valuable tools that are used in the evaluation of children who may be on the autism spectrum. Then we have the parent report. The parent report have proven to be a valuable tool, particularly for evaluating children from birth through 36 months of age. This is because children at this age, they are very young still, especially the newly born, the toddlers. Children only start saying first words at 1 year old, and then they start to pick up combined words at 2+ and start to use a fuller language by 3. Yeah? So it is not feasible for us to test the child directly. Yeah? And we would like to know also the development that the child goes through from birth to, from let's say toddler, 8 months old, until they are 3 years, 11 months, for example. So parent report tool tap into a parent's extensive knowledge and frequent observation of his or her child's ability, because parents are the people who spend a lot of time. If they're not working, it's 24 hours, 7 days a week, 24 hours a day, 7 days a week, and 365 days a year. So they are the best person to report on the child's development. But of course, if they are working, it will be lesser, but still, once they are home, they would spend a lot of time with their children. Also, to improve reliability and validity, the parent report tool asks for current abilities rather than past skills or age of acquisition. So they say, can your child do this? So parent report inventories have been shown to have good to excellent reliability and concurrent validity in relation to direct assessments and analysis of free conversation samples. Although accuracy may vary by age and social class. Predictive validity is only fair to good. Ability to predict is fair to good, usually because some delayed children catch up with peers during the preschool period. So sometimes these are the late talkers. They don't show much development initially, but they will catch up during the preschool years. So in terms of predictability, parent report has not a good not really a good predictive ability. Language sampling. Language sampling is an essential part of any speech and language evaluation, and it has been shown to be less biased against culturally and linguistically diverse children when we compare to standardized tests. So there's no bias because you are capturing the child in his home ground, in his comfort zone, and he's playing naturally and talking naturally. So it is basically based on the child that you are assessing. Yeah? It also captures the child's use of language in the most natural way with spontaneity. So that is what we want. The child to be at ease and using using a lot of language as naturally as possible. A variety of activities can be used to elicit a good language sample from the child, including pictures, describing pictures. For example, you give the child a train station photo and ask the child to describe what he sees, things that he sees, activities that people do that he sees in the picture. Or toys that can be given personalities and manipulated. So you give them toys, for example, dolls and costumes, and you get the child to dress the dolls or act out certain scenes described by you. And we can transcribe this data by using the language profile, which is the language assessment remediation screening procedure, LARS. This you have done in the clinical linguistic course. Whatever is used, the idea is to get the child to be interested and engaged in order to encourage the child's highest level functioning to emerge. For this reason, it is also important to collect sample utterances from the parent or guardian. As I always say, it's always very important to have a language sample with interaction. So you have the adult say something, the child respond. The child says something, the adult respond. So if there's any questions about the meaning of what the child says or what is the context, it is easily recovered from the language sample, provided you have the child and the adult utterances in your transcribed language sample. Language sample can be used to collect lots of data and lots of types of data. For example, you can collect phonetic, phonology, syntactic, semantic, and pragmatic. Then we have criterion reference assessments. This is the direct assessment. Yeah? So criterion reference assessments outline identified criterion that should be met. For example, what do you want to test? You want to test intelligible in speech. So you have a list of words that you want the child to say after you, for example, or if the child is able to read, you give him a list of words and ask him to read the words. Yeah. So based on the performance of the child, you can actually say, oh, he achieved 50% of the intelligibility speech, or he actually performed 90%. Yeah? So it is based on the aspect that you're measuring, intelligible speech. You can also have a criterion reference assessment which focuses on grammar. So you put it in items which test the child's ability to use grammar, get the child to answer the question, and then grade it. So like 80% onwards is good language, 50% is median, you know. So you can actually identify or assess the child's ability for a certain skill that you want to do. So this is criterion reference. Yeah? And criterion reference may not be normed. Yeah? May not be normed. Usually it's not normed, but there are instances where they could be normed. So, but majority they are not normed. Okay. The next one is dynamic assessment. So the dynamic assessment identifies learning potential and focus primarily on the engagement between the adults, either the practitioner, educator, caregiver, and the child, so that there is gradual assistance and elicitation of language and conceptual learning indicated. When using this kind of assessment, the SLP does not necessarily ask what the student already knows. In other words, language knowledge is not assessed. Rather, he or she asks how the student learns. This circumvents or go around the problem seen by many ELL, English Language Learner students, which is a lack of prior knowledge of items presented on standardized tests. So dynamic assessment therefore facilitates diagnosis of speech and language impairment as well as planning of intervention. So you don't really test direct confrontation like that with the child, but you see how he incorporates his knowledge of grammar into whatever he's doing, the way he says things, the way he replies to the stimuli. So this includes what we call baseline approach, which is test, teach, and test. So test stimulus, so there will be test, stimulus, variability, and graduated prompting, whereby intervention overlaps with assessment. When working with multilingual children, Gutierrez and Pena recommend that the test, teach, test is better for differential diagnosis between difference and disorder. Yeah, so this is an approach that is, in a sense, that there are things that you want to test, but you don't really test it directly, but you test it indirectly by your questions, by asking certain questions, by how the child responds to the question, how the child uses the structures to communicate with the caregiver, for example. And then you have the norm reference or formal measures. So norm reference tests, they require standardized procedures for administration and scoring, and they generate age-adjusted standard scores. They allow comparison of an individual child with children of the same age. So when you assess a child, you can compare the child with the other children in the same age range. So if testing a 4-year-old child, results from the test would enable you to test children in the same age group, which is 4 years old. So you can see whether they are age appropriate or not. So norm reference tests are often used to qualify a child as eligible for early intervention services or other supports, welfare aid, other supports. So let's say kalau if there is a requirement by the welfare department that you want to see the language abilities of the child, then you can provide the norm reference formal assessment. In the States or in the UK, in Australia, they require that. They require a evaluation from a speech language therapist, okay, for consideration of whether eligible for services. You can also compare the language abilities of the child to other abilities such as cognition. How is the cognitive score? Or motor skills. How is the motor skill ability or the gross motor skill ability? So norm reference formal measures play an increasingly prominent role in the evaluation of children as they grow older and their skills become increasingly differentiated. It is very important because you need these results in order to give better management of the child. So it's not just enough to say, I think he's a bit impaired, he has language impairment, but you must know what is impaired, how is it impaired, what can we do to overcome the difficulty. So with all these questions, we need to do testing. The norm reference formal measures usually test receptive and expressive skills, and they are usually tested in separate subtests. And the results from this components subtests, you can have a subscale scores. You can have a composite score, a total score of the test, and you can also have a subscale score for receptive, subscale scores for expressive. So you can really see what is it that is giving a low score on the composite. Is it the receptive, the understanding, or is it the expressive, the production? All right. So examples of local standardized language tests is our Malay preschool language assessment tool, MPLAT, which is standardized, and the new RANEL developmental language skills on Mandarin. But this might not be norm yet. It's just been developed. So let's see the new RANEL developmental language scale and RDLS. There are three characters, monkey, teddy, and rabbit, presented as toys initially, and they are featured in the picture-based sections of the test. So there are two sub-scale, which is comprehension and production. In 1997, the RANEL developmental language scale was published, but there has been some modification that was done, and in 2013, based on an article by Letts et al., they talk about the new RDLS. So what are the new sections of RANEL developmental language scale? So what is new is they have added single verbs. Section on single verbs have been included because the research has shown that there is a great importance of verb vocabulary in typical children and children with impairment. There's also a sentence building section. The importance of building up productive predicate argument structure over time in simple sentences. So it gives opportunities for the child to test the child's ability to put together items, elements in a simple sentence. And then we have another new section, which is verb morphology and pronouns. So this is to reflect the importance of this in identifying children with developmental language delay, DLD, or SLI. So yeah, so this has been included. They've also included complex sentences. So they have sentence building section, but they have at another level, which is a complex sentence. They also have grammatical judgment, which is meta-linguistic awareness for the older children. That means children are asked, how do they would they judge certain sentences that are being given to them, and children will say, yeah, it's grammatical, or yeah, I use it, or no, I don't use that kind of that way. So this is a new grammatical judgment. And then you have the multilingual toolkit. Multilingual toolkit is some guidelines that the author has prepared for to adapt the NRDLS to other languages. But of course, this has to come with their permission. So this is the components in the new RDLS. As we can see that there is the comprehension section, and then we have the production scale. So we look at component A, selecting objects, points to name object. This is just pointing. So and then in the production, naming objects, name indicated object. So you get the child to name. Name me this object. What is this object? Name this object. So the child has to produce the word. In A, the child just point. So point is representing understanding of the words. The B, relating to objects. Move item in response to instruction. So if the child understands the instruction, the child will move the items according to their understanding. And vice versa, if they have problem in relating the two objects, then they will move them in correct way. Then you have on the production side, the same thing. And this is sentence repetition, where they are given a description of the two objects and then they repeat. Component C, the verbs. So animates toys in response to instruction. So you sort of use the toy to do something, and then a verb describe what is happening. Tester animates toy. So describe what is happening to the toy. Yeah? And then another kind of activity, select picture from an array of 4, and then says what toy is doing in what picture. Picture. D is sentence building. Animates toys in response to instruction. Instruction is given and the child use the toy to do certain things. In sentence building, describe what is happening. So the tester will animate the toy and the child will describe what is happening to the toy. For sentence building, number 2, select pictures from an array of 4, and then for the production, says what toys are doing in what picture. Then there is the verb morphology, as we have said. This is a new addition. Selection of picture to show action still taking place or completed. Yeah? For the verb morphology in production, we have a sentence completion, maybe a blank in the sentence, and then the child fills in the blank. Pronouns, only for comprehension. Answers yes or no to questions about the picture. And then complex sentences, selects pictures from an array of 3 complex sentence elicitation. Inferencing, points to character in composite picture in response to question. Grammaticality judgment, judges whether the sentence is grammatical or not. So this is an example of the norm reference structured standardized test. Yeah? So we will, some of you will read an adaptation of the new RAR Developmental Language Scale in Mandarin. This is a study done by Lim and Lee, 2017. This is an article assessing children's native language in Mandarin using the adapted new RAR Developmental Language Skills, published in 2017 by Dr. Lim. Yeah. So basically in this study, they wanted to adapt the NRDLS to Mandarin, and this is to provide preliminary norms for the local children. So this study used 40 children between the age of 2 to 6-11. It aims to describe child language acquisition based on performance of the adapted NRDLS. The present results show that language skills advance with age. Gender and maternal education do not affect child language development. Overall, children demonstrated a more superior language comprehension than language production. This is the general known knowledge. And they did some reliability and validity tests, and they found that the adapted NDRLS Mandarin is developmentally sensitive. The present findings implicate an influence of universality and ambient language effects on acquisition of Mandarin. The present findings also implicate a need to develop a bilingual Mandarin-English version of NRDLS. Yeah, this is very good. Okay. So I will show this later. So let's go back. Okay. I'm going to move on to Y. show you why we open. Show you testing. So this is a PowerPoint which shows why do we test. Oh, it's not able to read. Huh? Let's see. Let's go back. Start sharing. Share. Let's see. So we're going to talk about testing needs of local children. Why do we test children? So the purpose this PowerPoint will talk about the purpose of testing, characteristics of good test, and local testing scenario. So we employ speech language therapists employ a variety of tools, and these tools to assess linguistic and communicative skills. And these tools comprise of informal methods, like we said just now, and formal measures. These are the tests available in the market. You can see that there is the RDLS, the one that we just discussed just now, and then we have the PPVT, picture vocabulary, Peabody picture vocabulary tool. We have the PLS, preschool language scale. We have the OLS, it's a writing test, and we also have the KELF. KELF is like RLDS, yeah, in a sense, test grammar. What about Malaysia? We don't have a tool in Malaysia to do that. This is very important, having tools to assess children, because this is statistics from the Ministry of Health in 2016, where it shows the number of children who attends the speech clinic in government hospitals. So as you can see, there is a great increase from 2013 to 2000. It's increasing trend. It's on the increasing trend, and you can see that the there's a jump from 2013 to 2014, and then a bit higher in 2015. So all of these cases, if we don't have a tool that can identify them, whether they are at risk or not, and how severe they are in their language impairment, it's difficult to manage them effectively. Yeah? So what we're saying is that there is an increase of cases being seen at the clinic, and this poses great difficulties for the speech language therapists. Then another statistics which shows the breakdown of the kinds of language disorders. So you find that the highest is the speech and language delay, or we call it developmental language delay, where the increase is always on the increase, a lot from 2011 to 2012, from about less than 10 to 20 and 25 and then 32 and then 39. So the increase is quite significant. And then we have oral rehab for hearing impairment, articulation disorders, voice and fluency, feeding and swallowing, and acquired language disorders for adults. So, so as you can see, SLD is on the increase. So SLD, their quite significant deficiency is language. So so a lot of kids are having language difficulties here. So why we need to screen? The purpose of assessment is first to screen the children to identify potential problems in development and to ensure that their development is on target. It's instructional in that we do the assessment so that it informs us on what is the next step to do. It supports our justification. It monitors learning. Diagnostic, to diagnose strengths and areas of need to support development, instruction, and or behavior. To diagnose the severity and nature of special needs and establish program eligibility. And sometimes it is a way to evaluate program evaluation or program accountability by measuring the outcomes, the progress of children going through the program. And this is done by assessing the children. So on the part of the children, we want to know what they know. We want to identify what are their special needs. We want to determine whether they are at the proper place that they should be. If they are not in the proper place, where should they be in order to keep up with their friends, the typical friends. And then you need to select appropriate goals, curricula, to meet the children's individual needs. So if they have some deficits, you need to know how do we try to help them to overcome their problems to achieve their needs. Okay? So in an early intervention program, the curricula is very important in special classes, refer children and as appropriate their families for additional services to programs and agencies. So when you refer children, it would be good to have an assessment done so that you can actually feel confident in referring the child when you provide concrete evidence to support your referral. What does assessment mean to family? So assessment is important for families because you supply the parents with information about their children's progress and learning, and with this information, the parents can actually help the child in a very meaningful way, very structured way, very directed way through the guidance of the speech therapy. Okay? So the parents and the speech therapy can actually work hand in hand to ensure that the child achieve outcomes, good outcomes. And we can also relate the activities in the clinic to activities at home or activities in school. Yeah, so there's always a connection between the child's life. If the child is going to a preschool, so we want to relate the child's ability at home, at school, and in clinic, so that it is interrelated. It is helping each other, because the aim is to improve the language ability of the child. Okay? So when there is a connection, the child will have good prognosis. Um, and in the preschool, the teachers need to know, the assessment will help the teachers to know the children's skills, abilities, and needs. The teachers can work hand in hand with the speech therapist to prepare lessons and activity that suits the child's ability, and set goals which are realistic. It helps. They help. Information that you give to the teacher will help the teacher to place the child at an appropriate place in the classroom. So for example, if it's a hearing impaired child, make sure that the child can be in a place where he can listen carefully to the instruction. Not much noise, not much noise in a sense. Yeah? So where the child should sit. Select materials that are appropriate, make decisions on how to implement learning abilities, use this information to report to parents and family about the child's developmental status and achievement. So knowing that the child has this difficulty, the teachers can play a role in helping the child to learn. Yeah? And this can be used in the report to parents and families. The information can be used to help to monitor and improve the teaching learning process and to meet the individual needs of the children. Okay. So to complete a valid assessment, you must understand the construct you're assessing, identify the question you're trying to answer, and gather information from a variety of sources. So it's very good to make sure that you get information from different kind of testing, natural testing, direct testing, getting it from teachers, from information from the teacher, information from the parent. Yeah? Understand what you're assessing and know what questions are you trying to answer. We want to consider, for example, what are the child's strengths and what are the child's weaknesses? What is the child's learning style? What is the best way to teach? Or what is the best way for the child to learn? What is the child's ability to learn? What type of progress is the child making in classroom or in the therapy room? These questions sum up to help answer the big question. Is the child typically developing, or does he or she have a language impairment? So characteristics of good test. The test should have a detailed and comprehensive test manual. Detailed information on the size of the sampling, makeup of the normative sample, test reliability, and test validity. It is based on a large and diverse normative sample. The tests have been sampled on a variety, for example, on 100 kids for each age range. It has sampled sufficient number of participants from different backgrounds. Yeah? It gives opportunities to assess the skills from different perspectives. The same skill being looked at from the comprehension aspect and the expression aspect. Yeah? It has current normative value. The test should be updated on a regular basis every 5 years. Has strong reliability and validity value. So it has different kinds of reliability. So for example, you have a test retest, whereby the study has done the test retest so that irregardless of when you test the child, you test the child at one point in time, and then 2 weeks later you test the child, the results would be similar. Yeah? Or one tester tests the child, and then in 2 weeks, for example, another tester tests the child, the results should also be similar. So with that reliability, it shows that the test is reliable. So we should always choose tests that are strong and extensive evidence, and has extensive evidence of reliability and validity, to over tests that offer only limited or weak data. It has clear instruction for the administration and scoring of the test. So when you get this standardized test, it's very important that you go through the manual very carefully, you go through the scoring sheet very carefully, because it tells you how to administer and how to score. And this is very important. It has appropriate stimulus items, in that they are appropriate to the age of the child, they are appropriate to the social environment of the child, they are appropriate to the cultural environment of the child. So you'll not be testing for snowmen for children in Malaysia, for example. Things you only test things that children are exposed to, are familiar with, not something which is like a unicorn. You test a child on unicorn. The Malay language doesn't, or any Asian languages does not have unicorn in their vocabulary. So be culturally appropriate. It has been revised every 5 years. That you are well trained to administer. So the person who administers the test must be a person who is trained to do testing, who has been trained to use this test, and if there is an update, trained to use the updated version of the test. So you must get the training before you administer. So yield useful diagnostic information and design treatment tools, treatment goals. So some tests may provide solid assessment results that are not easily translated into treatment goals. So it is preferred that a test that can generate both solid diagnostic and treatment target suggestion should be preferred. It makes your job easier. But if it doesn't, it's okay, because you can always use that information to actually design your own treatment goals. Okay, so now we're going to look at a tool that is the indirect tool. Okay, I'm going to share. So this is a parent report tool, which we call Profile Bahasa Awal Kanak-kanak Melayu. So I'm going to go through with you the sections in the tool. Okay, so first is the personal information about the child, the date of birth, the date, the age, the main languages that the child is exposed to, whether the child is attending TASCA or Tadika, the date of assessment, and who is the tester. Then you can have a summary of your scores. This test or this parent report can be used for parents whose children are between 8 months to 36 months old. So we have the first part, which is perilaku, gestures. So, sila tandakan dalam ruang yang disediakan sekiranya anak anda melakukan perilaku yang nyatakan di bawah. So, whether they do it or not. So, depends lah if it's a 8-month-old child versus a 1-year-old child versus 2 years versus 3 years. So, parents will actually just take whether their child do this or not. So, memberi perhatian kepada nyanyian dan muzik, mengikut penunjuk atau pandangan ibu, memahami arahan mudah yang disertai dengan perilaku, dengan gesture. Mari sini, kita wave, jom kita buat isyarat tangan. Bagi ibu, our palm is extended to the child. Jangan, our index finger is actually giving some warning. Jadi adakah dia faham? Dia meniru pergerakan orang lain tanpa vokalisasi, menunding jari, pointing, menunjuk objek. Adakah dia boleh melambai, cium tangan atau pipi bila seseorang, menunjukkan perilaku habis atau siap, melihat kepada objek atau orang dengan bermakna, mengangguk sebagai tanda setuju, menggeleng sebagai tanda tak suka, angkat tangan untuk diangkat, mengambil giliran untuk bersuara, memalingkan muka apabila menandakan interaksi sudah berakhir, mengikut irama lagu yang dikenali. Dan part A2 ialah vokalisasi. Kita nak tengok dari segi vokalisasi, menghasilkan vokalisasi yang nyatakan di bawah. Sila nyatakan tik dalam ruangan yang disediakan sekiranya anak anda menghasilkan vokalisasi yang nyatakan di bawah. Jadi ingat masa kita bincang tentang parent report tadi, kita kata it is valid in a way because we are asking the parents to indicate at the present time what their child can do or cannot do. Okay, so so kita kata Geman menghasilkan bunyi-bunyi expansion, menghasilkan jargon, mula pelbagaikan bunyi seperti a, u, e, bah, pah, mam, mah, meniru bunyi-bunyi, menghasilkan bebelan, baba, dada, mama, menyahut apabila namanya dipanggil, menghasilkan bebelan menggunakan kombinasi bunyi konsonan yang berlainan, aba, apa, pada, mengulang bahagian atau sebahagian atau keseluruhan perkataan. Adui, makan, nak. Bahagian B pula ialah perkataan. Sila nyatakan dalam ruang faham F sekiranya anak anda memahami perkataan yang berikut. Sila tandakan tandakan dalam ruang cakap sekiranya anak anda sebut perkataan berikut. So kita bagi parents untuk menandakan sama ada anak dia mana perkataan yang anak dia faham atau faham dan cakap. So kita ada certain like bunyi-bunyi yang onomatopic, bunyi yang meniru bunyi-bunyi persekitaran misalnya kan. So miau, broom, mamam, shishi dan sebagainya kan. So ada tak budak tu guna, dia faham tak dan dia faham dan guna. Ni dari segi pompon, bunyi kereta, ye, oh, nah. Lepas tu kata sosial dan kata rutin. Adakah anak kita boleh faham dan cakap perkataan ini? Assalamualaikum, bye-bye, mari, tak boleh, jom, nak, ada, tak nak, terima kasih, tak payah, tahu, entah. Dan kita ada kata, dan lepas kata sosial dan rutin, kita ada kata nama. Adakah anak puan boleh menggunakan perkataan seperti ibu, ayah, kakak, arnab, ikan, kucing, kata panggilan keluarga, ini anggota badan, Ini binatang-binatang, yang ini buah-buahan, pen dan pensel, baju, makanan, air, susu, nasi, mi, makanan, barang di dapur, barang di bilik air, mainan, peralatan di rumah, buaian, kenderaan, ya. Bagaimana dengan kata kerja pula? Adakah anak anda faham dan cakap perkataan-perkataan ini? So, salam, makan, bangun, kencing, peluk, potong, suka dan sebagainya, kan? Ini semua activity verbs. Okay, lepas tu, so we have about angkat, buang, dengar, mandi, pasang, tarik. Okay, lepas tu kata sifat. So, kita ada adjective, bagus, baik, banyak, cantik, comot, jatuh, kotor, merah, sikit, suka, takut. Belum. Kata adverb. Adakah anak kita faham dan cakap atau saja faham saja? Dia faham tapi dia belum cakap, kan? So faham saja, belum, dulu, nak, sudah. Kata tanya, apa, bila, apa pasal, macam mana, mana satu, siapa. Kata arah, kata penentu, kata ganti nama. Sana, sini, sana, bawah, tepi, dalam, itu, ini, kita, dia, kata ganti nama. Lepas tu, bagaimana dengan kata hubung? Dia boleh tak guna bagi, ni untuk budak yang besar sikit lah, 3 tahun lebih tu, kan. Bagi atau dengan, sebab, dekat, di, kata preposisi. Kemudian kita ada kata penegas seperti mesti, wah, adu, alamak, tidak, juga, lagi dan sebagainya. Okey, kemudian kalau ada perkataan-perkataan lain yang anak anda faham dan cakap tapi tak ada dalam senarai di atas, boleh diletakkan di sini, ya, untuk rujukan penguji. Kemudian bahagian ketiga ialah pembentukan kata, di mana kita melihat pembentukan kata dari segi kata itu digunakan berkombinasi, kata majmuk misalnya, ataupun ada gandaan. Jadi kita ada kata majmuk seperti air oren, air sungai, anak patung, bulu mata, kereta polis, ataupun kita ada tak anak kita guna gandaan, budak-budak, gula-gula, itik-itik, jungkit, sama-sama. Bagaimana dengan bentuk berimbuhan pula? Adakah anak kita menggunakan perkataan berenang, berhenti, menggoreng, buaian, mainan, terbalik, terbengkok, terjatuh, terpatah? Bagaimana dengan gabungan kata pula? Gabungan kata ni selalunya dalam 2 tahun, 2 tahun 4 bulan macam kan, mereka telah mula menggabungkan perkataan. Jadi kita nak tanya, adakah anak anda telah mula menggabungkan perkataan? Sekiranya anak anda belum mula membuat ayat pendek, anda tidak perlu menjawab soalan bahagian ini, ya. So kalau anak anda ada kata nak minum, so kira tu dah gabunglah perkataan tu, kan. So kita minta ibu bapa berikan satu contoh ayat terpanjang yang anak anda pernah cakap. So dia kena ingat dan dia kena tulis kat situ yang terpanjang. Kemudian jenis-jenis ayat kita tanya juga, adakah anak anda membuat ayat untuk menjelaskan atau memberi komen tentang objek, orang atau kejadian yang berlaku di sekelilingnya. Contohnya dia minum. Ada tak ayat penyata, kan? Kalau ada, sila berikan contoh. Ayat perintah. Adakah anak anda menggunakan ayat perintah untuk membuat pernyataan sesuatu? So jika ya, apa? Ayat seru. Ayat seru seperti alamak, jatuh. Ataupun ayat tanya. Adakah anak anda menggunakan ayat berikut, ayat tanya? Saya berikan contoh. Contohnya mana pinggan, kenapa pecah, kan? Soalan yang menggunakan siapa, ada tak? Soalan yang menggunakan bila, soalan yang menggunakan kenapa, macam mana, masak sup macam mana. Jadi based on this kita boleh kira dia punya tick yang ibu bapa tu dan kita masukkan dalam this one summary ni okay. Alright, so this is profile bahasa awal kanak. Okay, I'm gonna stop sharing. So I'm going to show you the students who actually collected the data for this. So development of profile bahasa awal kanak-kanak Melayu. Okay, so I'm just going to show you some slides now. Alright. So profile bahasa awal kanak-kanak Melayu. Actually, let me show you the students. Yeah. Wang Tan Ang Jupin. Okay. So early language. Elsewhere, early language among children 3 years old and younger have been extensively studied. Both describe parent report measures as measures that are intended to be completed by the parent or caregiver of certain child. These measures often take the form of checklists or Likert scale items that are given to parents. There are various types of parental checklists. We have the receptive, expressive, emergent language test, RAR, a method of assessing the language skills of infants, RAR 2. We also have the MacArthur-Bates Communicative Development Inventory, CDI3, by Fenson et al. The MacArthur-Bates Communicative Development, CDI, is a recognized method of data collection and has shown to be a valid, reliable, and cost-effective method of studying communicative skills and language of infants and toddlers. Vocabulary acquisition, specifically involving routine social words and word classes such as nouns, verbs, and functional words among 21 Irish children, was examined based on a bilingual Irish-English CDI. It was a mixed method of CDI and longitudinal data. They discovered that there is a pattern of early lexical development from routine and social words to nouns and predication, and culminates in an increased emphasis on grammatical functional words. So you can see that the studies done abroad in the UK, they use the CDI and parent report, and they can see that there is early lexical development. First the routine and social words, and then to nouns, and then the verbs, and then it culminates in the functional words. So we want to see whether in Malay, for example, this pattern occurs. Then there is variation across acquisition of word classes across languages. And it takes into account aspects of words like phonology, morphology, semantic or syntactic characteristics of the words in the language. So the Malay profile bahasa awal kanak-kanak ni kan, the objective is to establish an early vocabulary checklist for Malay children within the range of 8 months to 36 months. We wanted to describe the development of gestures, words and sentences, and also we want to develop the parent checklist. So the justification is that most SLPs in Malaysia use Western standardized tools which are culturally and linguistically inappropriate to to assess our local children's language skills. So this leads to questions regarding the accuracy of clinical diagnosis and the efficiency and efficacy of speech-language pathology services provided. So how can we give good clinical judgment and diagnosis and delivery of services when to our local children, when we are basing it on Western norms, Western tools. So it's very important that we come up with our local tool. Therefore, there is a need to develop a local standardized test or tool to allow SLPs to compare the language abilities of the children to local normative data. So in this test, in this research, we actually took 400 parents whose children are healthy, typically developing growing children, aged 8 to 66 months. They are Malay parents and Malay is their dominant language. They use Malay as home language. These are the exclusion criteria. So we take 8, 9, 10, 8, 9, 8, 9, 10, 3 months, 3 months interval, all 3 months interval, and each of the interval will have 50 kids, 25, 25. The instrument is a Malay profile of early language, which is profile bahasa awal, kanak-kanak Melayu. It has gestures and vocalization for the younger children, and then it has words and sentences for 17 months to 36 months. So the gestures and vocalization, gesture 20 items, vocalization 8 items. The words altogether 331 words with 15 semantic categories in terms of faham dan cakap. Symbolic words and routines and social words, nouns, verbs, adjectives, adverbs, WH words, direction words, determiner, pronouns, connectors, preposition, exclamatory words, negation, stress words. So word forms. We looked at affixation, we put in affixation, we put in compounding, and we put in reduplication. We looked at word combination and we asked for the longest sentence that the child has said and the type of sentence that the child used, whether it's declarative, command, exclamatory, and questions. We didn't have any other tool for this age range, so we had to use a variety of sources. So first of all, we base it on our intuitive knowledge and experience on children developing language, because this study is being involved the lecturers, all the lecturers at that time in the speech science program, and also the students, the final year students. We did a focus interview with 5 parents to get at the kind of language that the children uses. We took spontaneous language samples from another research grant by Razak, language samples from 133 Malay children. We looked at local published works. We looked at standardized international assessment tools, the MacArthur CDI, the RAR. We look at Malay grammar books, and we look at picture books, picture storybooks, picture dictionaries, and other reading materials available in the market for that age range, which is 8 months to 36 months. So this is the procedure. We did a pilot study, 30 parents participated, and we had some recommendation from parents. We cut down the number of words. We use layman terms in the instruction. We provide more examples at gesture and sentence instructions that the section, so that the parents understand. Clear instruction. So the selected outcomes. So you can see that this is the mean, this is the minimum, this is the maximum. So for the 8 to 10 months, the mean is for gestures. Total number of gestures is 11.74, 11 to 13 months, 16.58, 14 to 16, 18.48, and 17 to 19, 19 to 92. So it is generally increased in mean as the increase in age. So this is the median, minimum and the maximum. And then you can see that the gestures increase across age. These are the gestures which are acquired within the range of established Western norms. And then these are the varied acquisition patterns of these findings from the study, from our study to Western norms. So our children were able to point to requests, point to share experience, show objects, wave bye-bye, give kisses, signal all done and finished, touch mother, gain eye contact, shaking head to indicate no, turn taking. And when you compare the norms, you find that our children basically are getting it later than the Western norms. The Western norms gets it earlier, but we detected it later, a bit later for our children. So like this, okay. Vocalization. So you find that acquired within the range of established Western norms. These are the vocalization: raspberry gurgling, squealing, yelling, growling, producing sounds, canonical babbling, and varied acquisition pattern as compared to Western norms: variegated babbling, jargon, non-speech imitation, respond to name, vocally, word imitation for vocalization. Comparison to the norms, we find that the Western norms have it that the children are doing it earlier, between 5 to 10 for variegated, but ours showed later stage at 17 months, jargon at 14 months, sound imitation at 16 months. So gestures are used frequently until around 18 months, when their use begin to fade as verbal language develop. So for the younger age children, gesture and vocalization are considered as the primary mode of communication. And then vocabulary. So in a sense, when we look at the vocabulary, we look at comprehension and production. We find that for comprehension, they started earlier. So at between 8 months to 10 months, we can the parents are reporting that the child are understanding some words, and then more words as they go older. Production, no words was produced at 8 to 10. A little bit, maybe a very small bit of it was produced at 11 to 13 months, but they actually produced a whole word at 14 to 16 months. Maybe 12 months old is one word. And then the production increases. However, when we compare comprehension and production, the production has lower scores compared to the comprehension, and this is in line with studies in the literature. Okay, so when we look at the this is the receptive vocabulary, the understanding, and this is the expressive vocabulary, which is the production. So we find that there's a spurt here between 17 months to 19 months, a spurt of understanding, and then there's a plateau. It becomes quite constant, and then there's also a spurt here for production, a spurt between 23 months before 2 years old, and 25 months. So there's a big spurt between 45% to 70%. So the kids are doing a lot of producing a lot of words at this point. Okay. Then we look at the words, social words, nouns, verbs, adjectives. So I just wanted to show you, the things that we can get, that you can use as speech therapist when we publish this finding, and the tool that you can use for children, for younger children below 3 years old. All right. So I'm gonna stop there. I want to go back to go back to see. So my first PowerPoint is now just this one. Yeah. So I've shown you the various the direct way of assessment, the indirect way of assessment, yeah, and the different kinds. On this Friday, I'm going to show you. We're going to talk about one tool that is used is the first standardized tool, the Malay preschool language assessment tool, and okay, so we're going to look at the components and maybe try try a little bit at applying, looking at a video and assessing the child in the video. So for my topic, which is this lecture and then the lecture on Friday, the assignment, which is I think 20%, is to, so you have to form 5 groups, and you need to choose one of the following readings, choose one of the following readings which discusses an assessment. Critically evaluate the characteristics of the assessment in light of what we have discussed in class lectures. So you can look at, for example, these the Mandarin Renal, you can look at the MPLAT, you can look at the Malay LARS, the Chinese LARS, and you can look at the Profile Bahasa Awal Kanak-Kanak. We want you to, so for example, you take Renal. So this is, you have to choose 2 or 3 articles which uses this test, and then give your analytical analysis of this that Renal article by Dr. Lim, and then in the context of standardized tests, in the context of testing Chinese children, for example. You know? So I will write up properly this assignment requirement and put it in iFolio. Yeah. The same goes for Malay preschool. This is actually a standardized language test. So you want to discuss the MPLAT in terms of the language, the standardized language tool, what it does, and then see what it says. And then maybe some of you want to compare between MPLAT and Renal. And then we have the free language, free conversation sample, which is the Malay LAR. So you discuss the method of sampling using profile language, or any other things that people do that uses free language sample. Okay, so you want to be discussing about this profile with other kinds of things that people look at. So maybe MLU, maybe look at some IP syntax, index of productive syntax. So for example, if you're doing Chinese LARS, there is a paper by Carmen, a study on article what she does with the language sample. Profile awal ni, you can look at any language, any article which talks on max CDI. CDI, and compare it with our profile, and just talk about, critically evaluate the characteristics of the assessment in light of what we have discussed. So you can do that. Okay, so thank you. I think this is all that I'm going to talk about today, and we're going to discuss, continue discussing it on Friday this week. Okay, so thank you so much for your attention.